Sometimes I realize that I'm talking out of my ass, even though I don't have an ass. Today, I'm speaking to a woman who has also been through ostomy and rectum removal, but she's had a very different experience from the one I've had. While I healed over time and my vagina feels mostly normal now, she's been plagued with pelvic floor dysfunction and phantom rectum syndrome. She's going to share her journey with us, what she's doing now, and how she's coping with this difficult complication. It's easy to feel alone when you're going through this, especially when information online is practically non existent. Welcome back to Intimacy After Ostomy podcast. Today, I'm speaking with Samantha, a woman that I find extremely courageous because she's willing to talk about subjects that nobody's willing to talk about. And what really made me want to speak to her the most was when she told me how she couldn't find any information on what she's going through. And it was really difficult for her to find other people and information about what she's going through. So today, she's going to share her story and talk about subjects that most people won't talk about. And I'm just really grateful that she is willing to open up about these really sensitive topics because people will feel alone when they don't know that anyone else is going through this. So I think it's really important. So thank you for being here. And Samantha, can you please tell the audience a little bit about yourself and how you came to be in the position you're in now?
Well, I am 54. I'm a mom of three. I was diagnosed with ulcerative colitis. That was a mishmash too, but that was 20 years before it went fulminant. And I basically collapsed and was hospitalized for quite a while and bounced in and out of the hospital for the following year until I finally got my ileostomy. I had what they call lead pipe colon, which means I'd lost all of the haustral formations. And it's a radiography term that only the radiologists use it, but that's what had happened. So there's like no passage for output or bowel movements. So I would be in excruciating pain and faint and vomit, and I wouldn't be able to stop. And I would just get hospitalized over and over again. Finally, they took out my intestine, but my sad little rectum couldn't recover. So the following year, I had a full proctectomy. And I think I'll start there because uh, I ended up with pelvic floor dysfunction. And the truth of the matter is the doctors never told me anything. They didn't mention those risks. And I remember being in the doctor's office and thinking, well, maybe I don't, asking questions. And he said, whoa, whoa, this isn't a choice anymore. You don't have any options left. This has to be done.
Mhm.
And so I suppose I didn't ask a lot of questions. I just accepted that it was going to happen. And I didn't realize what the outcome would be. But following the surgery, the first 3 months were okay. I mean, of course, you have to learn to sit and let your bottom heal. I actually had a suture that poked out of my bottom, out through the skin. I wanted them to cut it off so badly and they wouldn't touch it. It had to dissolve by itself. So it was not a great time, but it healed. I've read lots of things about people whose rectums don't heal so easily.
Mhm.
And I'm very, very grateful for the ease of the actual healing of the wound. It wasn't all easy, but it could have
Mhm.
been a whole lot worse.
Yeah.
I remember at my 6 week follow up asking the surgeon what he had done to my vagina because right from the beginning, feeling where the sutures were, it felt like my vagina had been sewed up. And after having three babies, I never had stitches for any of them. So this was my first experience with any kind of sutures down there.
Mhm.
And he said, I didn't do anything to your vagina. He was quite aloof about it. And I was like, I remember thinking BS and not saying it out loud, but I think he knew. So we
Mhm.
talked about what was happening to me because I was having a lot of phantom pain. And I think that in the early days, maybe that's common, but I, well, I'm 3 years out almost from my proctectomy, and I still have phantom pain every day. It's how I start my mornings when I wake up. One of the ways I might be able to help people is to explain what I've learned through dealing with the pain clinic about
Mm-hmm.
um, pain in general, but understanding why it happens is it's they have a really neat analogy that I'd like to share, because they say if you think about your pain like an orchestra, and the orchestra has practiced this song of pain a lot, then all they need is a tiny little hint of the tune, think earworm, and it goes and it blares. So for me, as soon as I heard that, it made a lot of sense, because 20 years of IBD, you wake up in the morning in a lot of pain, and the first place you go is the bathroom. And
Mm-hmm.
however long it takes to overcome that pain is what I would just have to stay and wait, you know?
Mm-hmm.
So um, my orchestra still sings loudly, but at least I understand the song. And I don't necessarily have a remedy for it, but I've learned ways to cope. I do take gabapentin, unfortunately, and I would like to be off of that. And this is where GI doctors aren't so great. Um, but I don't really have a way off of gabapentin right now. I wean
What is
myself.
gabapentin?
It's a nerve. Well, it can be used for many things. So they use it for seizures.
Okay.
But for me, it's for neuropathy. It also can be used, I think, even as an antidepressant, which many of the pain meds that they're offering me for neuropathy are antidepressants. And
Mm-hmm.
I've taken duloxetine before for the same kind of idea, pain. And I will never put that in my body again. It gives the jolts, like you turn your head and everything goes,
I had that when I was going off of an antidepressant. It was a Fexer.
ah.
And it was, and I felt like like little brain zaps, and like it was just dizzy, sick, so dizzy and sick. And for years after, I would occasionally get like a zzz or a little like the same thing, and I would know it was like an aftershock or something from going off of an antidepressant.
Uh-huh.
Yeah,
I
that's
occasionally
crazy.
do even get them from the gabapentin, but at least I recognize and it's not like
As
it was
bad.
before. And fun fact, when I went off duloxetine, I was in the middle of a horrible IBD flare, and I literally just laid in bed and went through withdrawals.
Wow. You are
I was
amazing.
down
I
for the
literally
count.
took open the capsules and like one or two less globules. That's what I was doing.
I believe it. I believe it. Yeah.
It was a
No,
crazy, crazy journey.
I went cold turkey, which I know they don't recommend, but I was not ingesting anything anyways. And
Hmm. Can we talk a little more about like what happened to your vagina? So when I hear your
mm,
story, what I think of, first of all, I immediately contextualize it based on what I went through. And I had rectum removal proctectomy, just like you. And I was even having issues in my vagina before that. I was having
mm,
swollen Bartholin cyst. And that's why I had this big fear that there was going to be this big blowout abscess that would create a huge hole between my rectum and my vagina. And I was like, I need this surgery like now, like fix me, because I
mm,
was so scared of what was happening to my vagina. And like you, no one, it didn't even occur to me that it might affect my vagina because nobody said
yeah,
anything about it. Like
nothing.
nothing. It makes sense when you think about it now because they're exactly beside each other, like the colon and the vagina are exactly beside each other. It kind of it makes
They're
sense now
two
that
pillars. Yeah.
yeah. So
Hmm.
having that removed, it makes sense now that it's created a cavity. But then when you say, because you say the doctor did something to your vagina and you felt sutures in your vagina area. Now, I didn't feel sutures in my vagina area, my perineum area, but not my vagina. I didn't feel them in my vagina at all.
Right
And
to the
and I had
brink.
some fistulas really near my vagina because the fistulas were going into the infected cysts, but not into my vagina, thankfully, but
Right.
very close to it. So I would have been not been surprised if I had found some sutures down there, but I don't remember any. I did have like a kind of a gaping hole right where my butthole used to be, and it was draining. And
Yeah.
the surgeon said they couldn't sew it back up, and that I would need to go to a wound clinic until it healed. And so I was going to a wound clinic and having it packed and cleaned and packed and cleaned
This is what
first
I was talking
daily,
about.
and then
Yeah.
every other day, and then 3 days, you know what I mean, until it's healed up, right?
Yeah.
Yeah. So
And it
you
took a
didn't
long
go through
time.
that?
Hey.
Yeah, it took like months.
Yeah.
Yeah. Did you not go through that?
No, I didn't. I was
Okay.
really lucky. Everything stayed intact. My doctor
Good.
was really careful because I was on, um, well, I wasn't on prednisone anymore by then, but I remember him leaving my sutures excessively long and no one was taking them out but the surgeon. He was
Mm,
adamant about that.
okay.
And I believe it was close to 4 weeks before he finally took them out.
Wow.
Yeah, because he wanted to make sure it was all. I visited him
Hmm.
multiple times. We shared a lot.
But it seems so it seems strange. I think you described to me once that it felt like he had like sewn something to the back wall of your vagina and that it was pulled in or pulled back or something.
Yeah. So basically, what he said to me was like, I'm fairly thin, and he'd said that after he did it all, there just wasn't a lot of skin to pull it all back together. So everything was really tight, and one spot of my bottom, like kind of above where your anus would be, is like a ridge, like a horizontal ridge that is super tight still to this day, and there's
Hmm.
nothing I can do. So sitting is something that needs a lot of adjustment. Like I've bought new chairs, I've bought so many different things for my car seats, I bought
Hmm.
new vehicles, and I'm finally starting to realize that the waffle cushion that I bought on Amazon for $14.99 is just my best friend.
Yay. You know,
So,
that's so interesting that you say there's a ridge, like a horizontal ridge. I don't have that. I have a vertical ridge that goes down the crack of my ass because it's like they pulled all the skin together and then in a big thick
oh yeah, no.
fine like bound it with really thick sutures that dissolved, but it left a ridge sticking out of my ass. Now, the
So
horizontal ridge
extras.
that you speak of, I believe I have the same thing down in between like my vagina and the perineum area, between where my vagina is and where my butthole used to be.
I have that as
I've
well.
got two little like divots where there's like these horizontal kind of ridges that stick up. And if you look at it, someone might think I have a butthole because there's that little kind of divot right there. And yeah.
So I have many of those. Like I would say that I can feel where every suture, like, because I don't know, it's like they went like this with me. And it sounds like with you, there was a little bit of extra skin, and that's
Hmm.
what you're exposed to.
Yeah.
So I think he used a little bit of the edge of my vagina to anchor the skin because there was nowhere else to anchor it.
Hmm.
And so he will say he did nothing to my vagina, and maybe in essence he didn't, because I guess it has its own back wall, right?
Hmm.
But when he sewed me up, what has happened is I have permanent surgical damage. And if I feel inside my vagina, maybe between the 1 and 2 inch mark, just like you say, there's that ridge. So it's like you go in, and I'm going to go this way,
And
you
it
go
goes
in, and then
over.
it just kind of goes like that.
Yeah.
Behind that, I think I also talked to you about, there's definitely a pooling zone. So
Mm.
thankfully I'm in menopause, so this doesn't cause me a lot of problems. But for the younger ladies, this pooling can cause a lot of problems. Like right after surgery, I had excess discharge, and it would just come pouring out just
Yeah.
all of a sudden. And then when I went through menopause, I did like 6 months of constant bleeding, really heavy bleeding, and it would pool and then tip. So I have found one other YouTuber who talks about
I
vaginal
think I saw
pooling.
her. I think I saw her. She said she was having that problem with discharge.
Yeah.
And I
Oh,
found
yeah.
that my discharge changed since my surgery too, and it still is different. I don't know. Have you noticed that?
I have I have a huge lack of discharge in all things that would help a vagina be healthy,
Mm.
unfortunately. So I've also been having some other troubles which have brought me to the gynecologist. So I've had exams with the speculum, and this has proven to be so difficult that they were trying to get a biopsy and couldn't get a proper biopsy because I'm too uncomfortable to tolerate the procedure. So I've
And that's
been,
because your vagina is tilted in a weird way and it's anatomically incorrect now.
yeah. So it's
That's,
bad enough they insert the speculum, but then they want to open it. And so they're like pushing on
oh,
that ridge that I'm talking about, right?
yeah.
And that ridge is also like, I talk about phantom pain, but I have real pain there. So the
Hmm.
phantom pain comes up when I'm laying on my side or when I'm standing or whatever. But when I sit, I get pain in that zone. So it's, uh, I don't know, it's just an unavoidable nervy place. And I am
Hmm.
sure it is nerve problems. My GI doctors talked about a pudendal nerve block. I don't know if you know what that is,
I
but
don't.
that would be actually like some kind of, I don't know whether it would be cortisone or some kind of something injected into my pudendal nerve, which is your into my bottom where my rectum used to be.
Okay,
I
okay.
honestly think my GI doctor thought he was going to scare me away from everything. Like he blames any pain that I have on my phantom rectum pain, because if you wake up in the morning in pain, it's going to ruin your day. And I don't believe that phantom pain ruins my day, but
Hmm.
doctors can.
Yeah. Doctors can ruin my day too.
So nowadays, what have I done for myself? I did a year of physio and pelvic floor therapist,
Hmm.
specializing. And what we discovered is that my vagina was actually over, I don't know what the right word is. It wasn't slack, it was too tight.
Okay.
So
Like clenched, right? I think I've heard someone use that word, or when I was reading up on this, it said that due to so much trauma and tension, it can just become like almost permanently clenched.
yeah,
Is
so
that correct?
yeah. And so when I started trying to work on relaxing it, I lost, like, I have chronic back pain from years before from a fall, but it immediately triggered all of my back problems,
Mm-hmm.
because I think that my tight pelvic floor is what's holding my core all together. Obviously, my core is not very strong. I've had two surgeries. Um, I'm a
Multiple
mom.
children. I mean, yeah, I know. Same with me. I'm like, my core is not, I used to have like abs when I was a young woman. Okay. Now it's like no belly button, scars, a bag, and there's
Yeah.
definitely some core strength issues.
Yeah. So it was crazy because we ended up doing like this circle of things. So I worked on my back, and then my hips would hurt, and we worked on my hips because it's the thigh bone is connected to the knee bone, right? And so we
Hmm.
basically did this like circular on my body, and we worked on my obliques, like working up my sides and my hip
Hmm.
abductors and my back. And is kind of crazy because when we went back to working on my pelvic floor, it had gotten worse.
Oh,
And so she said, like, your tailbone curls in. I want you to like, I don't know if I don't know if you've ever done pelvic floor therapy, but
no.
there's a lot of visualizing, because
Okay.
of course this is nothing that you can see, or even feel with your hands. It's like,
Hmm.
envision yourself opening. So she kept saying,
Hmm.
like, breathe and pull it back. And unfortunately, I did say to her, I can't, because she kept telling me to do it, and telling me it wasn't working. And I was like, well, I I can't. I don't know why. I don't know what I'm doing wrong. Um, but it's not.
I mean, does she have experience with people who've had their rectum removed? You know what I mean? Like pelvic floor therapists, I think we're kind of a rare breed, and they might some of them be doing more damage than good for all we know.
Yeah. And in the end, because we had done this whole circular workout on my body, I found Gentle Aquafit, and it does everything. I go in
Okay.
there, I get a little bit of cardio, I get the full stretch, I get um, the cool down at the end, which is another stretch. So like we do like they call it stationary exercise, but that's one kind of stretching, and then your cool down is your other kind of exercising.
And the
Uh,
resistance of the water is your
yeah,
resistance,
Yeah.
right?
And in 45 minutes, I've done anything and everything I ever worked on with my pelvic floor therapist. Well, with the exception of my pelvic floor. But
Yeah.
I spend a lot of time like concentrating on, okay, like, let that go. But when I let that go, say I'm walking and I'm like, I can let go and relax my pelvic floor, I immediately get the pain in my rectum, or my
Mm.
phantom rectum.
That makes me think it's not phantom.
It's not phantom. It's
You know what I
not.
mean? It's
Nope.
being caused by something. That's what I think. I mean, but like I get that feeling sometimes like I need to take a crap in my ass.
Yes.
And that is very rare, but when it does happen, I just assume I probably do need like I probably am gonna have a bowel movement, and a piece of my colon back there is triggering memories or whatever, like triggering the muscles or the feeling back there. And but it really passes quickly for me, and it's not every day, not even close. But like I don't have like the vagina issue and the other issues that you're having. And if you, when you release the clenching or whatever, and it causes the rectum, phantom rectum pain, well, to me, that's all connected. And that's what the doctors don't understand, I feel like.
Well, they think my GI doctor is all about it's nerve damage. Like I have a
Hmm.
lot of pain in my abdomen as well, and I actually wonder if maybe it's like a small hernia or whatever, because it really does surround my stoma and stuff. But it doesn't
Hmm.
matter what I say. It's like, oh, your blood work is normal. It must be nerves or depression or,
My
I'm done
blood
with.
work was normal for 2 weeks as I went in and out of the hospital with a hole in my bowel.
You know
And
what?
it wasn't abnormal until I was almost dead in
Same.
the hospital bed.
Yeah. I know because I did 20 years with IBD. Don't tell me my blood work is normal. I've
Yeah.
seen that before. And,
Yeah.
I had a rheumatologist and I liked the way she said it. Yeah, yeah, you look good on paper.
Hmm.
I
Yeah,
really, really like that.
no doubt. We look great on paper, even
Yeah.
like because of the invisible disability. Nicole and I did a podcast about this the other day, and even on that in that way, we look good on paper because you can't tell that we have a disability by looking at us. Like you're be absolutely beautiful, and
Thank you.
and you can walk and talk, so therefore you're not disabled.
That's right. It doesn't matter what
Meanwhile,
kind of
you've got
pain you're
like,
enduring in your body.
yeah, meanwhile, you're going through like a lot of stuff.
I know, like I even said it to my doctor about like the endurance factor, right? Like
Mhm.
I have a lot of pain that I don't even share. My body embarrasses me because there's so much going on with it that I'm very selective about what I want to take to the doctor or what I think I can't cope with.
Mhm.
But for the most part, I endure. And she tried to correct me, like endure it kind of means that you're not in a good place or you're not having a good time. And I'm like, no, it means I'm getting through. Like
Exactly.
endurance is getting to the other side or staying stoic in the moment,
I
right?
think endure is the perfect word to describe what it feels like when you're sick and you just have to keep going.
Yeah, she wanted to change my mind and I wouldn't let her. I was like, no, it is endurance. And I think I did change her mind in the end. She's like,
Hmm.
oh, okay, like this isn't a negative
Like it's
statement.
not a negative statement, but it's not fun either to have
It's
to
a way of
endure
life.
this. Like,
I've endured other things. Yeah. But I don't know if I said so in my latest gynecology visit, I was actually put under generals because it's
mhm.
the best way for them to deal with me. And he said that if I continue to have problems, they're just going to remove my
And that's just for your
uterus.
normal pap smear type of test, is what you're saying?
Colposcopy.
Okay, what's that?
Yeah. So a colposcopy is when they take a biopsy of your cervix,
Oh, okay.
and I can't tolerate the speculum.
Hmm.
So
I mean, they're
because I
uncomfortable for those of us with a normal vagina. I don't even
yeah,
know if I would be able to do it now with after all my surgeries.
see, and I had the funny thing is my first, because I've been having an issue that's been ongoing, but my first colposcopy was actually done with the same doctor pre-proctectomy, the 6 months before, or not even 6 months. And then he saw me again and couldn't even get a good sample.
Oh, honey.
So at least he understands. And
Mhm.
by the way, I should also share that I did something for BC because Penthrox is a sedation that is like it's an inhalant sedation, like nitrous gas,
Mhm.
that can be offered in hospitals for colposcopy clinics and things like that. BC doesn't offer it because it involves modifying the hospital with ventilation and stuff like that. So you
Mhm.
can have Penthrox in a doctor setting, like in an office, but not in the hospital.
Hmm.
So my doctor, I'm like, what am I going to do? He said, write a letter, write a letter. So I wrote a huge letter, and then I got mad at the one place because they kind of sent me a dismissive response, and I'm like, reread it. Uh, I write a great letter.
That's awesome.
Anyway,
I'm glad that there's an
I
advocate like
actually,
you.
pardon me.
I'm glad there's an advocate like you doing this.
And that's what I said. This isn't just for me, it's for every woman who struggles with pelvic floor issues in this setting because
Yeah.
we're not properly informed. We aren't given respectable options. We're
Hmm.
expected to A, deal with the pain no matter what it costs us,
Hmm.
or B, take poor choices like general anesthetic. And one of
Mhm.
the people that I talked to acted like it was no big deal. Like, oh, so general anesthetic twice a year is no big deal when there's another way around it. Come on.
Mhm.
But I did get a letter recently saying that it's going to a board.
Good.
So whether it had anything to do with me or not, I don't
It
know.
did. Because you
But
wouldn't have got that letter if it didn't.
I'm pretty excited to take it to my gynecologist to be like, oh, look.
That's
So
awesome.
I
Good
don't
for
know if it
you.
will get there for me, but
Mhm.
like by the time I need it, but that's okay
Well, thank you for doing that for all of us.
for the greater good.
Yeah.
Everything I do with this, I think, is for the greater good. Like talking to you or talking to anybody about my ostomy, I try really hard not to hold any shame about what's happened to me. I mean, I
Mhm.
think I was poop shamed my entire life
Yeah.
up until the point where I didn't have a choice.
I know. I know.
But you can't, I was a sibling uh, of, I have three others, and they weren't the nicest, and we bullied each other. I don't know if
Mhm.
I was a bully as much as them, but it doesn't really matter. I think that's where it all started. And I think I
Mhm.
spent my whole life feeling that way. I don't know that it had anything to do with what happened to me with
Mhm.
IBD because I remember always having tummy troubles. Like I can
Mhm.
remember being super young and
I've
having
got
tummy
my
troubles.
theories on those things.
I was 19 and they kept looking at my reproductive system all the time. And then when I was about 26 or 27, it was, oh, you're constipated. I'm sure that lots of people have heard that. And
Mhm.
um, it wasn't until I started bleeding from my rectum that I was finally properly diagnosed.
Wow. So I had constipation like my whole life, and then it was a vaccine injury that made me have the opposite. I started having diarrhea, started having blood coming out of my stool, all of that, and I was just told I needed to eat more fiber. Didn't take me seriously at all. All my test results were normal, and I was even told it was in my head.
Didn't you have blood in your stool when you did like stool tests?
Yeah. But
What the?
not the in my head about the blood in the stool, but I just needed more fiber in my diet for the blood in my stools. Yeah.
Wow. How
And
wrong
the
is that?
doctor stuck his finger in my ass so hard it hurt
Mm-hmm.
so bad that I was scared to ever go get an exam again from any doctor. I thought, why couldn't he have been more gentle or like more lube or anything? Like, I don't know. It just was, he just hurt me. But yeah, it was just, it's crazy what we go through, what we endure.
What we endure. Yeah.
Yeah. So what would you tell people who are going through this kind of stuff now? Like what have you learned that you think other people could learn from? For instance, how would you suggest they bring it up with their doctor? Or you already recommended like Aquafit for exercising and building the core, right?
Mm-hmm.
Do you have any
Mm-hmm.
other suggestions or advice?
Well, for anybody who's going forward in the surgery, I love finding people on the pages saying, what's the thing that matters the most to you if you had been able to do it before your surgery, and definitely not being shy and talking to your doctor, whether you're a man or a woman, because I've since read that a lot of men also come out of these proctectomies with sexual damages,
Yeah,
right?
they
They
do. I
have
know. It's very
ED or
heartbreaking.
and I think that there's a lot that's not talked about. Like my doctor took my fallopian tubes out without talking to me, and
Wow.
and came in like the day after I had my proctectomy and apologized for forgetting to mention it. His exact words. So I was
Why the hell did he
standing.
do that?
Well, he why did he take them out?
Yeah.
I guess that fallopian tubes they've discovered are the cause of a lot of cancers. That's where it starts, is in the tubes. My
Hmm.
tubes were tied, and they according to the pathology they both had acute salpingitis or salpingitis, however you say it,
Hmm.
so they were very inflamed, but his
Okay.
words were, so I was standing there looking at them thinking, what should I do, and I just decided that I would remove them. And he really, should have been covered in our pre-op.
Hmm.
I didn't, I felt violated. I still feel violated by it, but at the same time, I feel like I would have been fine with it. So where do you go with that?
Yeah.
If he'd called my mom as my emergency contact and said it to her, she would have said, do it. Like, what do?
Yeah.
You respect them for making the best decisions for you. But anyways, back to it. I could have asked a whole lot more questions, which might have triggered him. Oh yeah, your fallopian tubes. If I'd started talking about my reproductive system in
Mm.
respect to what
Now
was
that
going to
makes me
happen,
wonder. if they took anything I don't know about.
You do you have your pathology or
I should
anything?
go and get it. I don't think I do.
Do you not have, like, where I am in Island Health, I have access online through, I think it's called Gateway or something, but I have all of my own medical records going back really far, like anything I have done, blood work,
Hmm.
x-rays,
I'll have to reach out
pathology.
and get that information from you. Good for
Yeah.
you. That's awesome. You know, one thing that this whole story makes me think about is that doctors who perform this surgery, there isn't a consistent way that they do it because clearly your doctor did it different from how my doctor did it.
Mhm.
And I don't think skinniness can be the only reason because at the time I was
Yeah.
96 pounds. I wasn't very big myself. Um, and I gained weight after the ostomy because I could never gain weight before. But like they do it differently. And do they share that information? Do they share best practices? Like this is stuff like I wonder, how do they
Yeah.
know what is the best way to do this surgery?
And I think it's a fair
Avoid
question to
something like
ask.
what's happened to you, for instance.
Like, I think a fair question to ask is how many of these surgeries have you done even? Like,
Yeah.
I never thought about that before. But I think about it now. And my mom, who is a retired nurse, she really feels like I need to write a letter to my surgeon and tell him what's happened to me
Hmm.
because he should know for his future patients
Yeah.
is her feeling. I have not done that.
And I
That's a
also
really
wonder
tough
if there's
one.
any way to like help you to, I mean, who wants another freaking surgery after everything we've been through? But with the situation you're in, if there was a surgical remedy for a doctor who could do that kind of surgery, I mean, I would probably want to look into that if I were you.
Yeah, there's a gynecologist that apparently specializes in pelvic floor. And the gynecologist that's been dealing with my other issues has recommended that I see him.
Okay.
I haven't done it. Um, I feel pretty defeated about it,
Mm.
and I also feel like having done a year of study with the pain clinic. One thing that I know is that the more we focus on our ill health, the more ill we feel.
Yes, I know.
And
That's
so
so true.
trying to fix my pain almost makes my pain seem worse because
Hmm.
it's not going away. And that's not negativity, that's reality.
Yeah.
Um,
Well,
so it's,
in the whole like law of attraction, energy, consciousness field, you ignore your problems. You
mhm,
ignore them because if you put too much thought on them, then you just create more of them in your life, right? So
exactly.
I get that. But then when your body is going through stuff, like sometimes it just can't be ignored. And that's how we ended up where we are.
Yeah. And I often feel that way. Like, well, I would like to wake up and have a day where I don't think about it, but oh,
Yeah. Right?
uh, but that's okay. I have a lot of silver linings.
Hmm.
I didn't even have a doctor before all this, and I have some good doctors. Like
That's
my family
good.
doctor is fabulous. And I, much like you know, my eating and everything has become a lot more enjoyable. And
Hmm.
uh, I'm not in a relationship, so my pelvic floor damage isn't a horrible tragedy.
At the moment.
It is a little bit of an issue for a new relationship because I don't think that gentle is just the first place that most men go, and
Mm,
gentle is the only place I can go.
me too. I think they
So
should all go to gentle.
yeah, yeah. But I think just not being afraid to ask questions of your doctors,
Hmm.
and being able to go to the places like, you know, like me looking my doctor in the eye and saying, "What do you do to my vagina?" You,
Hmm.
it's uncomfortable. We are in, like, we've dealt with a lot. If you've had a proctectomy, you've dealt with it all. You've
Hmm.
exposed your bare butt to everybody, and
Well, we're the
um,
only people who can advocate for ourselves. There's no one
yeah,
else who's going to
yeah.
do it for us, unfortunately.
No shame, right? No
Hmm.
shame. We are survivors.
I mean, the biggest reason I created the intimacy guide for people who had ostomies was because I had so many questions and I was too embarrassed to ask my doctor a lot of them. And looked for the information, like you said, you looked for information on the stuff that you're going through, and I looked for information on intimacy after ostomy and rectum removal, and there was really nothing there. I found that one girl on YouTube that talked about the like the little pooling that was going on in her vagina. And her videos were the only place I found anything even remotely about the stuff I wanted to learn,
Yeah,
you know.
yeah. Everything that I've found that has helped me has been from a YouTuber or from one of the ostomy pages on Facebook.
Yeah.
And they've empowered me to figure out better appliance setups and to not listen to my ostomy nurse because they're a guide, but they're not the one who makes the rules for us.
Hmm. And they're not all created equal.
No,
Ostomy nurses. Some are
no.
amazing and some are not so amazing.
And they don't follow up. I mean, mine doesn't follow up. She'll be like, oh, we'll do this. And then I'll have like the worst disaster that I've had in months.
Yeah.
But she's not there to say, did that work for you? I'm just like,
Mhm.
oh, forget her.
Yeah. I know. I know. The one time I had like a major leak was when I tried a new product and I didn't really understand how to use it. Another time, my bag came right off after I'd been to the ostomy nurse earlier in the day and she had placed my bag. Like,
Uh-huh.
these are two
Exactly.
situations that never happened when I used my usual stuff and did it myself, you know?
Mm-hmm. Sounds familiar, Trina.
Yeah. Well, I really appreciate you sharing all of this with me. Well, not just with me, but with the audience. And I'm excited for people who are going through similar situations to be able to see this episode and post questions in the comments. So I might direct you there if I see any questions that you could answer.
Absolutely.
And thank you so
Thanks
much.
for having me.
You're welcome. Thank you
Happy to
for
help.
coming on. And to the audience, if you want to check out the Intimacy After Ostomy Guide on my website, it's at intimateostomate.com. And I think I mentioned something else. Well, there's lots of resources there. So head on over. And oh, yes, the Facebook group. We have a group on Facebook called Intimacy After Ostomy. And I run that group with a few other wonderful ostomate people. And you're welcome to join us there too. And I hope everyone has a wonderful
Thank you. You too.
week.